Welcome to the Excellence in Training Academy, where trainers come to grow at excellenceintrainingacademy.com. Today's a special session, and we're going to talk about some technology that's available to help law enforcement agencies and public safety agencies as a whole better deal with wellness and peer support programs and do a better job of looking after their people. And just by a little bit of a preamble, just to give you a sense of the organization that we're going to be talking about, is after a number of tragic losses, Superior North EMS in Thunder Bay, Ontario, sought assistance in looking for a way to better support their employees' mental health and well-being on and off the job. While a peer support program had been recently implemented, delegating and keeping track of the interactions between the team and frontline personnel was difficult, with gaps in data collection and reporting hindering its growth. The result of this research and development is First Response Mental Health's PeerConnect project, which consists of a mobile app and administrator web interface with a companion training options. These tools help to foster better communication within an organization, as well as manage and track peer support and wellness programs to ensure every member is regularly and proactively connected with and has access to mental health and suicide prevention resources at all time. And this is such a critical element in today's world. And with us today is Nick Fiorito, and Nick is a project lead with First Response Mental Health. Nick has been developing and managing projects in the software and tech industry since 2012. His role as project lead involves managing research and development, client relations, training, and marketing. Nick leads the design for initial development of PeerConnect, and working with Superior North EMS refining the system to meet the unique requirements of a modern peer support and wellness program. Nick is a busy man with a lot on his plate, including a family of 8, but he knows that first responder mental health is doing important work to ensure those who encounter intense, stressful situations don't have to face them alone. So, Nick, welcome to the Excellence in Training Academy.
Thanks so much for having me.
Now, we were put into contact with each other through a mutual connection. Tom Klein with Chicago Police Department, and Tom and I have known each other for a long time through ILEETA. And then you and I had a phone conversation, and I looked through your website and watched some of the videos, and I was very impressed with what you've put together with this PeerConnect app. So can you talk a little bit about how you guys got involved as, IT people in this world, and then we'll talk about what PeerConnect is and the features and how agencies can utilize it.
Yeah, so we, being a software development company in Thunder Bay, as you mentioned, we originally were doing systems for large industries, so industrial clients like gold mines and hydro utilities companies. So we were more process-oriented, looking at key performance indicators and things like that. And so when Superior North EMS came to us, they weren't necessarily looking for an app or anything like that. It was just, Thunder Bay people know people, and they got a hold of us. And when we started to look at what they were doing and what other groups were doing, we thought that maybe by implementing some process into the program, we would have a bit better results, not only for management to know kind of that the program's working, but for the front line to feel a little bit more secure, a little bit more trusting of where their data is stored, what kind of data is in the system. So that was about just a little bit over 2 years ago that they first interacted with us, and we built them a system. We launched it in May of 2019. So as of this recording, they've been using it actively for about 14 months. And then it was kind of just supposed to be a one-off, almost a pro bono project. But we really found it obviously to be a very worthwhile endeavor. And just them coming to us saying we can't find anything that does what we're trying to do, then we obviously saw that there would be need for other first responder organizations to use it as well. So right now, I believe we're at 16 active groups that are using it, with many more kind of on the rollout or training schedule. So it's pretty exciting stuff.
Absolutely. So talk about the PeerConnect app and what it does and the advantages that it offers to public safety organizations that are utilizing it.
We we looked at what was out there, obviously, and not just app related, just any kind of programming, whether it was from a bulletin board on the wall, groups that had a part-time wellness or peer support coordinator, to some that were just doing it as a volunteer, obviously, depending on the size of the organization. So we looked at what was out there, and what we found was that a lot of programs, basically, I don't want to say all of them, but pretty close, they take you to a certain level that we call awareness. So it's being made aware of what's out there. I'm aware. I work, for this law enforcement agency, and I'm aware that we have an EAP number, for example, or I'm aware that there is peer support. So, signs, bulletin boards, even websites and things like that will make everyone aware of what's available. But we thought, how can we take that a little bit further and again, like I mentioned, put a process in so people move beyond awareness to an actual program or actual steps to take? How do we get people to access these either more often, but not for the sake of accessing them more often, but to understand when they do need to access them and lower the barrier to being able to do so and lower that stigma. So kind of bold claims, I know, and we're still working with some researchers to follow kind of long-term how this is helping people do that. But our early feedback from our initial groups that have implemented is very positive so far. So yeah, so we kind of have two sides, right? We have the awareness side, which would be a news feed and a resource board all within the app, so it's in everyone's pocket. And I should mention too, what we're doing is we're providing each organization with their own app. So, for Apple devices on iOS or Google Play, as well as a website. So it doesn't matter what the frontline person is accessing it on, they can log in and find what they need. So you have that side, you have the awareness side, there's self-assessment tool and things like that. You can list all your resources, newsfeed posts, different events, or photos, videos that you want people to watch. But then the other side of it was just, how do you manage a peer support program? So peer support, it's not a new thing. It's definitely nothing that we came up with on our own. It's been in place in some agencies for several years, 20 years. We've heard of some groups having it. But often it's a list of names on a bulletin board, or it's one or two people working in an office. And in some groups, it's very accessible. In some groups, people don't tend to use it as often. So what we do is allow for kind of, we call it the R3 model, which is basically you can request contact, you can refer or recommend for contact, and then we call the third one a rhythm, where you can proactively as an organization set how often each member is met with. So, if they don't push their button, if they don't get referred, some of our groups are using 180 days, some are 365, just depends on what kind of your percentage or your ratio of peer supports to total population is. But if I don't push my button and I'm not recommended for, let's say, 365 days, my name is going to pop up to the peer support team to just give me a check-in, just give me a phone call. I can set how I prefer to be connected with, if it's a text at this number or a phone call at this number. So I really have control as a frontline supported user of how they connect with me. And I can also actually choose who is on my peer support team. So if an organization, let's say it's larger and they have 50 peer supports, individually, when I log into the app, I can choose who's on my personal support team. And we tell people to keep it fairly broad, so that you're not narrowing it down one-to-one, but basically just lowering the barrier and making people feel less anxious, for reaching out.
Excellent. And I want to dive deeper into a few of those things, but I think, first of all, I know that one of the things that would come up, and I'm sure you encounter this, where people bring this up pretty quick, is how private and anonymous is this? I know people are always concerned about it, is how much am I putting out there, and is this just another big brother is watching type of thing? So can you talk a little bit about some of those elements, the privacy of the information and some of those other elements?
Yeah, for sure. We knew going into this, and as we were co-developing with the first group, that the front line needed to have those concerns addressed. But we also knew that the management or the administration needed to know certain things as well. So a few different things that we've done. When a peer support meets with someone to kind of satisfy that request or kind of close the loop, there's a contact form. And each agency can choose what questions are asked on the contact form, things like, the nature of the conversation. We're not tracking the conversation itself. So that's one thing we've actually decided not to do, is include like a chat or anything within the app, just to keep that information out of it. But when I fill out a contact form for a peer support interaction and hit submit, we strip the user's name from it. So you get a report, and we export a report. You can choose monthly or whenever you want, or you can view it live. We export a report that gives you the answers to those questions on the contact form, but no names are attached. So we found that we struck a good balance between the frontline user feeling comfortable accessing the program and having their interactions kind of captured in that way, and still allowing us to generate good kind of live measurable data, so you can know, what's kind of some of the reports that we're doing are, what's the average time from when someone pushes their button to someone commits to it? What's the average time to then when someone completes the interaction by filling out the contact form? And then, of course, how many interactions have we had, month, year, all that kind of thing. So we're giving some good reports, but still honoring those frontline people. And of course, the data storage and everything is kind of using modern, up-to-date encryption and secure technologies. We've gone through quite a few audits now on the security side for groups that have signed on with various IT departments, and we've kind of satisfied all those requirements for those groups, and they're now on board. So we feel comfortable, especially in our previous work with gold mines and things like that. They're also, as you can imagine, pretty concerned about how their data is stored. So took what we learned there and applied it here.
Excellent, and those are so important that people are getting the help, but also that that management or the organization can see how much people are utilizing the resources and how much of a need there is for some of these. Now, is there something where the peer support person would enter something, not necessarily again specifics, but to say, this person was referred to counseling, or they had a conversation, they were referred to appropriate resources, just so that again, when somebody's looking at the data, they know some sense of like closure or what resources people are going to beyond contacting peer support?
Yeah, so in many of the groups' contact forms that we're working with, they do have you can choose kind of if-then statements. So, did you refer this person to any other programs? If you hit yes, then you get a drop down of the programs that are in place. If they have EAP or a list of counselors, whatever, you can click that off. Again, we strip the name from that so that it's just kind of a total aggregate data for the organization. But recently we did implement a feature with one group that requested it. And so now it's kind of an optional feature for everyone because, you build one for one group, it's kind of available to all if they choose to use it, where you can send a note after an interaction to a specified clinician. So this one group, for example, worked very closely with a psychologist. I believe he's third party. He's not on staff, but that's their group's preferred psychologist. So after they meet with someone in a peer support interaction and fill out that form, the form, again, adds to the totals of the questions, but then they have the option to send a note. And we don't store that note. It's just sent out as an email to the clinician's secure email, so that there is some following, some tracing, if an organization chooses to do that. And that's something in working with this group, or with the groups that we're working with, when someone has an idea or a requirement for a feature, we can look at that and we can either build it specifically for them, or we can say, hey, you know what? I think everyone would appreciate this. Let's make it available to everyone, and they can choose to add it or not.
Excellent. Now, you talked about the 3 R's, where people can request help, they can be recommended, or you can set up a rhythm and be proactive in scheduling connections, just check-ins with people. Talk a little bit about how that works for the request and the recommendation or referral from somebody else, from a peer or a supervisor, to say, hey, I think Brian could really use somebody to reach out to him.
Yeah, so a couple of the reasons why, especially on the referral side, that we kind of chosen the path that we did is, again, we want to honor each person's choice for who is on their peer support team. So you have basically in the app, you have a list of all the available peer supports in your organization. And I should actually note that you can share peer supports among organizations, which is a pretty cool feature, because we do have a lot of groups that, police, fire, and EMS in a city or in a region often go to, especially if they're smaller groups, often go to the same calls, and often will do debriefs or peer support together. So you can share them across organization, which is a little bit hard to explain over audio, but is a really nice feature that a lot of groups are very interested in. But I, as an individual, can select or deselect who is on my individual support team, so that when, let's say, you're the supervisor and you know that I've gone to a bad call, or let's say me and my partner went to a bad call and you want someone to follow up with us, all you have to do is pull open the app, type our names in, hit recommend, and then it will go through each of our individual kind of curated lists that kind of acts like a filter. And people on our list will be notified. Basically, once one of them commits to it, it disappears. So I'm not getting, 10 phone calls. I'm just getting one. So peer supports have a little bit more control, as well as they're not anxious thinking, I'm putting my kids to bed, I hope no one calls me right now, or they go on vacation. So it kind of works really nicely both ways in lowering that anxiety, both for the supported user, looking at a list saying, who am I going to call right now? They take that step to actually call someone and they don't answer the phone, or they're away, or they don't want to maybe be that shoulder at this time. So it kind of allows both sides to have a little bit more control.
Absolutely. Now, with the recommend or the referral, some agencies there are some fairly large agencies, and if everybody's not on the system and ticked off their peer support people that they would like to be part of their team, and the supervisor recommends, and they send, say, Brian's name and say, we were at this call, and Brian and Joe and Bill, I think somebody should touch base with them. If we're not already in the system with recommended, or we've identified who we want to be part of that cohort, is there then a way that goes to someone in peer support, and they would still reach out to me and find out if I want to talk to them or somebody else?
Yeah, so we always default to whoever the administrator is, or whoever is listed as that. So you can have one or more, so that no requests obviously go to zero people. That's right. The opposite side, right? They could go to too many people, or if they don't go to anyone, then that's also a problem. So the administrator, or the wellness coordinator, peer support coordinator, whoever it is, or whoever they are, there could be multiple. Yeah, they have the ability. They'll always kind of get that request and be able to, as in a traditional system, which a lot of groups have, is you call the peer support coordinator, you say, hey, I think so and so should talk to peer support. They're going to find a peer support to do that and kind of matchmake, right? Right. Which what we are learning, what we hear from a lot of the groups, is that takes an enormous amount of time. So we're saving them on that kind of phone tag and coordination piece. However, in the back end, which the coordinator has access to, they can still do that. They can still assign a contact to someone. So kind of it accommodates kind of this newer or different way of doing things that we're doing, as well as a traditional way that most or many groups are already running their peer support.
Absolutely. And this is 24/7 coverage, right? So if it's the middle of the night and I need to talk to somebody, the system is gonna route it to somebody that will get back to me, and so I'm not gonna have to wait till Monday morning if it's 2 o'clock in the morning on a Saturday morning, correct?
Yeah, kind of a nice thing that we've put in is that you as an organization or as the administrator can set how annoying you want this program to be. So it will continually buzz someone until basically that request is committed to, and it will also escalate it up the line so that again, we're not letting any of these requests or recommendations or button pushes go stale. So you can actually set in the back, the number of hours. I believe it's by hours we have it set that it'll keep re-notifying people of either incomplete or uncommitted requests that are in the system. So it can be annoying in a good way, and you kind of set the parameters for that, for how active your peer support team is, or what kind of timelines you want your group to work on.
Excellent. Now, I know in some of your literature it talks about that it works with the wellness program, and that it provides support for families as well as for those on a leave of absence. And I think those are two groups that often get forgotten about, people that are off with injury or something else, and the families. Can you talk about how it provides the support for the families as well as those on a leave of absence?
Yeah, a few different ways. So for families specifically, I'll start with you can have a guest account for your organization. That's what a lot of groups will do, and there's no charge. You can, a guest account is a guest account. People don't have to log in, and so a lot of groups are using that to do their newsfeed and resource posts to family members, because I don't think I mentioned, but each newsfeed post, which is similar to a social network type post, but it's a closed system. You control the data, you control who has ability to post. Right now we don't have commenting system or anything like that, so it's pretty spam proof. But each of the posts, you can choose which roles are able to see it. So if I log in, my newsfeed within the app may look different than yours, depending on what our roles are. If I'm a peer support, maybe there's some training videos that we want the peer supports to have always in their feed or in their resources. That those can be specifically visible to peer supports, but not to maybe frontline users. In the same way, family members can have posts that are set either to the guest account, or some groups will actually add family members, retirees, people on leave, as actual logged in users. And then you can post things, newsfeed and resource posts directly to that group. So if I'm a spouse of a police officer, let's say, and I log in, I'm going to see a news feed and a resource feed. They're two different kind of tabs or buttons, contextualized to my needs and what's appropriate for me to see. So that's kind of how we're accommodating that. On that same token or that same note, when we talk about doing the rhythm or the proactive peer support piece, you can override. So I was talking about how some groups have 180 days, 365 days, whatever you want to set it to. You can actually, that's the default for the organization, but you can set different roles to have different numbers. So let's say new recruits, we want to be checked in on more often for their first year. You can set that number to, 45 days or 60 days. So they'll get a phone call more often. Same thing with retirees or people that are off, put them in a role and a group and set them to, 6 months or a year, whatever you want to do. But it takes away the possibility or the concern that someone's going to be, out of sight, out of mind, or kind of forgotten about, which is a big concern, as you mentioned, that we hear from a lot of our groups. It's not out of any ill will. Everyone really intends to keep tabs and follow up on those people that are off, but it just ends up, for whatever reason, and a host of reasons, not happening super consistently. So this is where it takes a bit of that guilt away, or a bit of that headache of trying to organize that.
Absolutely. Now, you mentioned retirees, which I think is another one of the forgotten groups, and we're seeing some pretty significant numbers with suicides and mental health issues with people that retire. And I know if people have listened to the interview with Kim Colgrove, I mean, her husband, after 30-some years of law enforcement service, took his own life within 3 months of retiring. Is that something where you can set it so that it might check in, say, every 45 days for the first 6 months and then goes to every 6 months? And then, so can you stagger that time where, people might struggle at first? Retirement sounds like a good thing until all of a sudden now you're cut off from your support structure and you don't see all your friends, and now you're an outsider, and maybe you've moved somewhere a little warmer and there's nobody that you know there. So is that another way that you could do that, to set it, say, for changing check-in times?
Yeah, definitely. You can set as many kind of role, like you create the roles. We do have some kind of what they call hard-coded roles, which would be like a peer support, right? Because when you log in as a peer support, you actually see different buttons and you have access to different features and functions. But in terms of roles like that, you can make as many as you want. And we also integrate, of course, being relatively new, we don't have every HR or management Active Directory type system for everyone yet, but we built the platform in such a way that it's relatively simple for us to integrate with these kind of programs. So, you don't have to be managing the PeerConnect app as well as all your other HR type software. So we can link roles and just however you want to set it up with that as well, to kind of automate things, so that if someone moves into a new role, if they leave for whatever reason or in whatever length of time, it can update that way, or you can do it manually in the system, either by bulk or you just know that, Brian, he retired. We're going to kind of add the tag or the role of a retired or retiree to his profile, and then he'll have that new default check-in time applied to him.
Excellent. Now, we talked about supervisors referring or recommending. I'm assuming that there's also the same ability for peers, that somebody who's not my supervisor sees me struggling and sees some of these things going on. They may have reached out to me and they know that I'm having a hard time. But so a peer could also recommend me into the system for somebody to reach out to me. Is that correct?
Yeah, we made this decision, and actually we can change it per organization, but none of our active groups have made the change just yet. So right now, if I'm a frontline user who's not a supervisor, not a peer support, I'm just working as a frontline police officer, let's say, I don't have access to everyone in the organization. I don't have that list right now. Only peer supports and supervisors can kind of search and look up everyone to recommend.
Okay.
We do have the ability, but again, no one's really asked for it yet, to make that open to everyone. But what we do right now, and seems to be working pretty well, is we encourage that button. So there's a button actually that says request contact, right? And everyone has access to that. So what groups are recommending for their frontline people is push the button, kind of lower the intensity of that button press, right? So it's not a last ditch kind of thing. Use it more often than a real crisis situation. So if you notice your partner in the car could talk to peer support, push the button. One of the peer supports is going to call you, and you can say, no, you know what? I'm doing actually pretty good. I'd like to recommend my partner. Then that peer support, who does have access to that list of everyone, can hit recommend. And again, we're putting that through the filter of who the partner has on their curated list. So again, we're always honoring who they've chosen, and kind of, again, process oriented, making it happen that way. And that seems to satisfy the requirement quite well, and just gets people more used to pushing that button. They know what happens, right? They're not, they're less anxious to press it. They know what the loop is like.
Excellent. Now, is there a way to enter in the system where it flags certain types of calls where, every organization has, and I don't want to just label older supervisors, but there's some people with an old school mentality that as a supervisor might not put their team in and say, you know what, somebody should connect with our team because of this call. Is there a way to flag certain types of calls that the administrator, if they get flagged on that and see that nobody's suggested that peer support touch base with people that were at this call, that they will initiate something?
Yeah, so that's actually that's a good point and an exciting thing that we're working on, and we're basically in testing with one of our first groups on that. Is they're an EMS group, but it would be similar for any police or fire, depending on what kind of documentation system or dispatch system they're using. But for this group, let's say when the two paramedics enter, well, I say two, there's often two in the truck. When they enter the details of the call that they were on, it will, if the call or the code is of a certain severity, which the organization can decide, that will actually auto-trigger a peer support, like a request or a recommendation in our system. So there is some automation. Again, kind of similar to the HR database. We don't know what everyone's using. There's a lot of different systems out there. So for each group, we would say, is this something you're interested in? Would you want to have automatic referrals as part of your PeerConnect app triggered from your dispatch or from your documentation system? If they say yes, again, we've built it in a way that it plays nice with others, basically. So you can choose, what kind of codes or calls would meet that criteria, and then that supervisor doesn't even have to worry about it, right?
Absolutely. Now, do you currently have any public safety communication 911 centers that are utilizing this? Because again, they're a group that very often gets forgotten about. Some of them don't even have peer support programs. Some of them are linked to agencies. Some of them are standalone. But it seems to me that this would be a tremendous value for public safety communication groups as well.
Yeah, actually, we right now we don't have any active clients in that space, but we do have very active discussions, I will say, with a number of groups, both in Canada and the U.S. actually right now, in terms of communications professionals they're very interested in this. Obviously, as you mentioned, they are not at the calls, but they're hearing of and dispatching all the calls. So definitely a group that, and I'll commend their leadership as well for. In some cases, seeking us out. In other cases, being very willing to discuss and look into it. And I believe the system itself, the software, works really well with a lot of different types of groups. Again, because it's kind of just a management system, right? What you choose to put in your newsfeed, the resources you put, they're contextualized to your group, which is why it works well for. We have actually corrections groups, quite a few. That are onboarding with us for corrections officials, border control, obviously police, fire, EMS, even some community groups. We've had one sign on whose workers, they're a group of about 500, and their workers work with adults with developmental disabilities, often in intense situations, right? So peer support is kind of universal, and while we develop this primarily for first responders, some kind of progressive or innovative group leaders are calling us and saying, yeah, I know it's for first responders, but do you think it would work for us? And we say, well, can't see why not. So it's very interesting in that sense.
Absolutely. There's so many applications for it. Now, the other thing that I noticed in some of the material that I was looking through is that you also have built things in to look after the peer support people themselves. Because, again, sometimes peer support people get so overused that they burn out. But you have built things into this system where there's those check-ins with the peer support so that somebody's looking after the peer support people and making sure that they're getting the support that they need as well, correct?
Yeah, absolutely. So as an administrator or as an organization in the back end of the app, you can limit the number of commitments that a peer support makes. So we have it set for a 30-day period. We could change that, but let's say you don't want any peer support to do more than 3 requests in a 30-day period, for example. you set that number in the back, and then if that peer support, gets a request and goes to hit commit, and it's their fourth one, a pop-up comes up that says, I can't remember the exact wording, but basically it's, you've already committed to the maximum number in a 30-day period. But then we actually, and this came from feedback working with the groups, it's not a hard stop. So they have a choice. They can say, yes, I'm okay to take it. Or they can say, no, redirect it back to the team. If they say, yes, I'm okay to take it, we allow them to do that. They can meet with the person or whatever. But then we send a notification to the administrator saying, peer support, John, is in kind of the red, or whatever the wording says. But basically, they're over the limit. So check in with them, maybe pull them off, or just have that discussion and say, you know what, we really appreciate the work you're doing. Obviously, you saw that you were past what we've kind of decided is a reasonable amount for a 30-day period. Maybe just back off, or just to check in with them, right?
Right.
So that's one of the kind of features or functions that we've put in to help with that. And another kind of interesting byproduct, which I don't think we really thought of at first, was that the coordinators. So let's say you have an organization and you have a peer support coordinator. Because they're not spending so much time playing phone tag, gathering reports, getting phone calls saying, I think so-and-so should talk, and then finding who to talk to, the coordination is really drastically reduced with our system, is what we're finding. So these people, the wellness or peer support coordinators, are able to spend more time taking care of the peer supports themselves. So a lot of the feedback we're getting is that, hey, I'm able to actually, have coffee or go out or talk on the phone with my peer supports way more often, concerned about their needs, not just passing along notes and information about the people that we're serving. So that's been a really nice byproduct of groups that have implemented this.
Excellent. Now, you've touched on this a little bit, but this is scalable for any organization, whether you have 10 or 1,000 members in your police department, or you have 5 or 6. It's the system or the app is scalable to work with every individual organization, correct?
Yeah, and that's kind of one of the nice things. And when the organizations do get larger, we're talking to some police forces of 5,000 plus members. We do have a few tricks or ways to manage things that we're doing. But we know that is not the norm. Most of the organizations are on the smaller side. Right. Police forces of 30 or 20, or different counties in the States, especially, that have smaller forces that, are autonomous, but also work together with lots of groups. So we do have a new kind of version coming out, probably in, I don't want to put a hard date on it, but it'll be a couple months' time. That's a bit more of a global version. So a group that is very small, they don't have to worry about having their own app on the store and all that kind of things. It'll be more of a universal logon, still giving them a lot of control. They're still able to manage their users and everything, but not having to make the commitment to, the whole setup of their own app in the iOS store and Google Play and stuff like that. So we're accommodating kind of groups of all size, and as well, we're allowing groups to share resources, newsfeed posts, all secure, but there's some neat mechanisms to do that, as well as peer supports. So
now, it seems to me the other unique challenge is you have agencies like the RCMP in Canada, the Ontario Provincial Police in the States. You have state police and other organizations where they cover a wide area, and they have detachments, a lot of small detachments around the state or around the country or around the province. So are they able to then customize this down to that detachment level as well?
Yeah, so you can actually set, so for larger groups like that, you can set locations, which is kind of a secondary filter for what people see, and also what peer support teams are available to them. So in the case of like a provincial or a state service, you may want to have peer supports available only to the locations, where they serve. Some groups actually like the opposite. They want peer supports to be available all over the place, so that it's not someone that is directly working beside you. There's different reasons for both approaches, and both have their merits. So it does work pretty nicely with that. Again, so not only can you post resources and newsfeed posts and things like that by the role, but also by a location in the case of like you said, situations where it's a large geographical area. And as a side note to that, or to continue with that, the original group that we developed this with, Superior North EMS, their catchment area is huge. It would be the same size as some states, larger than probably many states, in terms of our area here in northwestern Ontario. Not super densely populated, but a huge geographic area with bases in different. I think they have 14 bases, but half of those are regional. So a huge spread of land. So this really helps in that as well, right? It's digital, it's online. It doesn't, you don't have to be in close proximity.
And people can access this PeerConnect app from a phone, from a tablet, from a computer. They don't necessarily have to be on their department phone to access this. Is that correct?
That's correct. And actually, we've been pleasantly surprised at the kind of the uptake among users to put it on their personal phones and their personal devices, because it is for them. It is something that their organization is trying to do to support them. And I think that has been, that's been nice to see that in a lot of groups that don't provide organizational devices, people are putting it on their own phones. But like I mentioned, you can log in from anywhere, just any kind of modern web browser, so a tablet, a laptop, a computer. The advantage with actually having the app and downloading, from the App Store to your phone are the notifications. So that's especially important for peer supports and supervisors and the administrators. But again, if someone doesn't want to put the app on their phone and they just want to access it every so often, they can just type in their group's unique URL into the browser and log in from there.
Excellent. Now, is there, when you send out or you add something to a news feed, if there was something that you wanted everybody to make sure that they knew about, is there a way that people would get some message to make sure that you go and log in to check this information or something? Or is it only when I log in and go to certain things that I would have access to that information?
That is one of the, again, advantages of downloading the app, because let's say I'm an administrator and I make a new post. Let's say it's not, just a training video or something. It's something about an event or an incident that's happening. And I want everyone to know, relatively quickly. You can add a custom notification to each post, and actually you can send it out as often as you want. So even, for some groups using social media or something to do this currently, you can't send a notification, whenever you want. So I could make a post, and basically at the end of when I'm creating it, it'll ask me if I want to send a notification. And if I hit yes, I can type in what I want it to say on the lock screen, and then hit enter. And then everyone that's got the app is going to get that notification on their phone, and it's going to say right on the lock screen whatever I've written there. So in terms of a communication tool, it's really handy and pretty powerful in that sense. So that's basically the answer to that. Again, one of the advantages of having it on the phone.
Excellent. Now, you talked about the resources link or resources page, and again, the agency has a lot of flexibility of what they can add to that, because I know in the one brochure, it's, in a kind of a mock screen, it says, peer support, and then a self-assessment, behavioral health tools, mindfulness, family support, recruitment support, things like brain health and cognitive strength, compassion, fatigue, depression, anxiety. So an agency could put as many resources, so they could put links to meditation apps or meditation sessions, or really anything else that they want to put under that resources link. Is that correct?
Yeah, it's pretty flexible. So you can have, phone numbers, links, locations, things like that. You can also add tags to each resource. So if it's substance abuse or if it's marriage things or PTSI or whatever. People can search by tags, by keywords, so you can really narrow it down. We have one group that had a huge existing resource bank, and we were able to actually automate its input. So hundreds of entries were put in with all the tags and everything brought across. So that was pretty neat. As well, something I don't think I've mentioned yet, which is pretty cool, is often like consider, I don't know if you're on Twitter or anything like that, but if I built you Twitter and then said, okay, go at it, make all the content yourself, it would be pretty daunting and pretty boring to do that, right? So right. With our newsfeed and our resources, any group that has and is using our system, there's actually in the back end, there's a shared space. So if I'm an administrator and let's say my group makes a really good video on on officer wellness, and it's not specific to my group, maybe we made it, but we want to share that with others, I can actually choose to put it over into that public space, and any other app administrators using our program can kind of browse that space and say, oh, wow, that's really good. I'm going to include it in mine as well. So newsfeed posts and resources have that capability. So if you are, in a city or a region that has a resource and you think that other groups, first responder groups would want to access that as well, and, it'd be appropriate to share, you can stick that in that shared space, and the other administrators you can be collaborative and share that way, which is really exciting because often a lot of times these groups or these wellness coordinators will work kind of in a silo. They're maybe one or two people, or they're half time in their whole department, trying to come up with things and trying to keep things accurate. It's a really nice way for them to help each other.
Absolutely, and there would be some programs that are fairly well established that would have a lot of those resources that they could share, which would be hugely helpful to people that are just starting out.
Yeah, definitely, yeah.
So what else is there that we haven't talked about that are features of this that you would want people to know about? And then we'll get to how people can connect with you and find out more.
Yeah, I think we've covered most of it. I've appreciated your questions because you did your homework, and we covered some of the actual features that we don't talk about all that much on kind of a first look, which is great. I think family and retiree support or people on leave support is something that is emerging, really becoming more prevalent with the more groups that we're meeting with, as well. Just the ability to have a tool like this that doesn't require physical proximity. So obviously, the state of the world right now, physical proximity isn't happening for a lot of groups. So it really helps to keep a program or even strengthen a program that's not able to meet more regularly, or if your group is spread across longer distances, as well as the training for us on how to use the app and how to roll it out and launch it. We're doing that all virtually now. So I think we've onboarded 6 or 7 groups since kind of COVID hit and everyone's been locked down just over, Zoom or whatever video conference tool. So it's pretty easy to get up and running with our group virtually. And obviously that saves time and money as well in terms of travel and things like that.
Absolutely. And it seems to me that this is the kind of the missing piece, is that more and more agencies are building peer support, putting programs in place, but sometimes keeping track of everybody. And the other element, and I don't think it's as big an issue now as it was a few years ago, but it's still a concern, especially for agencies in the U.S., is people that are on military deployments. So people that are reservists and have been called to active duty and they're deployed, and a lot of times they're forgotten about and their families are forgotten about. And there was some agencies like Indianapolis that put some systems in place, but a lot of times those people, nobody's in touch with them during their whole deployment, and nobody's in touch with their family to make sure that they're doing okay and that their family's doing okay. So there's so many ways that this could be applied to make sure, and it seems to me that that's a big piece of this, is what you're striving to do is make sure that nobody falls between the cracks.
Yeah, that's what we're finding is that, of course you can push the button, you can be referred. Those things can happen more or less in a traditional system, like just even a paper-based or a phone-based system. You can obviously reach out for help, but trying to keep track of who's where, who's been connected with, and when, that's really difficult. And lots of groups are using spreadsheets or whatever system, a notebook in the wellness coordinator's office, trying to manage that. So that's really difficult, and that's where we're seeing a nice benefit to the system that we've kind of co-developed with the original group here. So I do think it is kind of, I don't want to say the way of the future, but it does provide that nice safety net of knowing that everyone's been met with, even if no one's pushed their button for a while, we know that everyone in our organization gets a check-in once a year, twice a year, whatever you decide. And to have that, that peace of mind is a really big thing.
Absolutely, and it's such a great tool to augment existing programs and developing programs, and truly take it to the next level and use technology in a good way. It's getting to the point now where a lot of people are afraid of technology for a lot of reasons, but this is a tremendous use of it. So how do people find out more? Talk about the website, talk about how people connect with you or find out more or schedule something to connect with you and go deeper with this.
Yeah, right now I'm doing a lot of Zoom meetings or video conference presentations. We do have a demo version of the app where I'm able to kind of walk through the flow of when someone pushes their button, what happens, because I find that visualization and seeing it allows people, answers a lot of questions, right? And we get a lot of the same questions, of course, because the concerns about privacy, anonymity, all that kind of stuff, which are first and foremost. Having that kind of meeting really allows us to answer those questions. So the website is firstresponsemh, as in mentalhealth.com. My email is Nick, N-I-K, spelled a little bit differently, but N-I-K at firstresponsemh.com. As well, you can just hit info on the contact form on the website. And we're setting up a lot of these kind of video conference presentations. No one's really traveling right now, especially still here in Canada. So they seem to be the best way to just kind of quickly get an assessment of when someone contacts us and we have this call, we really want to understand what they are currently doing as well, right? Where their successes and challenges are, what kind of system is in place, if any, or what kind of programming they have. Do they have peer support already? Are they looking to set it up? And while we're not, we definitely don't claim to be experts in the field of peer support programming in terms of what training you should do, whose program is kind of the best or things like that. We're just the support side of making sure that when there is that peer support interaction, we capture it. And we know that the people have been met with. We have that coverage. So again, our training is basically just how to use the app. We're a little bit agnostic to what peer support training or wellness training different groups have. Some have, internal training or psychologists they work with. There are other larger groups that do training kind of regionally or provincially or nationally. So those are, there's some I'm sure are better than others, but each group kind of at this point knows what they like or who they're using. So we're happy to accommodate kind of all those. We just provide the process for it.
And you have an advisory board of people from a variety of backgrounds, including some PhDs that help to consult with you on some of these issues as well, correct?
Yeah, anytime we look at a new feature, especially when we were building kind of the original feature set, but now that we've added kind of more and more as time has gone on and as we've had more users and more feedback, we're always floating those ideas by the people on our advisory, various kind of representing a whole scope of the mental health side of things, as well as law enforcement, fire, paramedics. So we have a good representation on there, and we just say, hey, we're thinking of putting in this new feature. This group has requested it. What are your thoughts on this? What are the pros and cons? What should we be aware of? So that's been really helpful. Of course, not that we're just a bunch of nerds. We definitely are passionate about this, and some of the stories that we've heard in working with groups and stuff have really, deepen the commitment that our team has had to this kind of cause, or this work that we're doing right now. So we're very passionate and excited about it. But again, having those PhDs, those psychologists, those veterans on the advisory board kind of keep us in check and make sure that we're focused on providing kind of the best product.
Excellent. Well, Nick, I want to thank you for your time today, but more importantly, I want to thank you for everything that you have done, everything you continue to do in this critical project to help with the mental health issue and the mental health crisis really that is facing the public safety and first responder community. And this technology, it's easy to write off technology, but I think this technology is something that is going to help agencies, regardless of where they're at in their program, to enhance their program and really to make sure that nobody falls between the cracks. So for everything that you have done, everything you continue to do in this field, thank you so much for your service.
Thank you very much for having me, Brian.
And I would encourage all of the listeners and the members of the Excellence in Training Academy community to take action by going and looking at the website and then reaching out, getting more information. Take this interview and share it, and I will send you the MP3 file. And if for some reason you don't have it, then contact me. But share it with your peer support people. Share it with those people that need to know about this, because I think it is that piece that is going to take some very good programs that are already in place and some good programs that are being built and make them even better to better serve the heroic men and women of law enforcement and of public safety as a whole. So to the members of the Excellence in Training Academy community, as always, thank you for your commitment to excellence both in and through training. Always continue to train hard, train smart, train with passion and purpose, and always be willing to dare to be great.